Q&A Part 2. Kidney failure. This illness has also stolen childhood from many children. KD, 11, Da Nang City, suffers from kidney failure along with chronic pneumonia. Since hospitalization, his father, Levon Kwong, has had to quit work to care for him. What illness does KD suffer from? He suffers from kidney failure and chronic pneumonia. When did KD's father quit work? He quit work after KD was hospitalized. Okay, please listen to the next part. Seeing my son lying still in the hospital next to the dialysis machine, unable to help him, breaks my heart. I only wish he could be healthy like before, Kwong said. What did Kwong see in the hospital? He saw his son lying still next to the dialysis machine. How does Kwong feel when he cannot help his son? He feels heartbroken. Okay, please listen to the next part. Treating patients like family. Dr. Nguyen Thi Minh Phuong, Department of Artificial Kidney, Hughes Central Hospital, said, kidney failure patients range from ages 8 to 90, with a rising proportion in the 20 to 30 age group in recent years. Who is Dr. Nguyen Thi Minh Phuong? She is a doctor in the Department of Artificial Kidney at Hughes Central Hospital. What does a rising proportion suggest about kidney failure among young adults? It suggests that more young adults are being affected now than before. Okay, please listen to the next part. Many young patients, upon first admission, fall into shock and struggle to accept the psychological blow of having to depend on machines for life. What happens to many young patients upon first admission? They fall into shock. What do the young patients struggle to accept? They struggle to accept the psychological blow of depending on machines for life. Okay, please listen to the next part. Therefore, beyond treatment, doctors often take on the role of family, encouraging and sharing with patients to help stabilize their mental state and cooperate in treatment. What do doctors do beyond treatment? They often take on the role of family, encouraging and sharing with patients. Why do doctors encourage and share with patients? To help stabilize the patient's mental state and cooperate in treatment. Okay, please listen to the next part. Sometimes we must coax children to cooperate with treatment or encourage elderly patients traveling dozens, even hundreds of kilometers weekly to the hospital, Dr. Phuong added. What do doctors sometimes need to do with children? They must coax children to cooperate with treatment. What do doctors do for elderly patients? They encourage them to travel dozens, even hundreds of kilometers weekly to the hospital. Okay, please listen to the next part. According to MSC, Dr. Dinh Thi Minh Hao, head of the Artificial Kidney Department at Hughes Central Hospital, the department is currently treating about 350 outpatients on dialysis, with 35 to 40% under 40 years old. How many outpatients is the department currently treating? the department is currently treating about 350 outpatients on dialysis. Okay, please listen to the next part. Common causes include high blood pressure from staying up late, eating salty foods, overconsuming fast food, using low-quality supplements, or unscientific gym practices. What are some common causes mentioned in the sentence? Staying up late, eating salty foods, overconsuming fast food, using low-quality supplements, and unscientific gym practices. What does unscientific gym practices mean? It refers to exercising without proper methods or knowledge, which can harm your health. Okay, please listen to the next part. Kidney disease often starts with hypertension and diabetes. To prevent it, one must maintain a healthy lifestyle, eat balanced meals, drink enough water, limit salt, sugar, and starch. Absolutely do not self-medicate or use unverified supplements, Dr. Howe advised. What are two common causes of kidney disease? Kidney disease often starts with hypertension and diabetes. How can you prevent kidney disease? You must maintain a healthy lifestyle, eat balanced meals, drink enough water, limit salt, sugar, and starch. What should you absolutely avoid when treating kidney disease? You should avoid self-medicating and using unverified supplements. Wow, you made it! Well done! Keep practicing until you completely master this. Remember, no pain, no gain. See you next time. Bye!